Hi, everyone. Thank you for joining us today for this webinar on men's sexual well-being and mental health. My name is Elissa Makris. I'm a business psychologist at Thrive, and today with me I have Sam Shah, who is the Chief Medical Strategy Officer for Numan. Hi, Sam.
Hello, thank you for inviting me, Elissa.
Thank you for being here. So yeah, as I said, this webinar will be on men's sexual well-being and mental health. So we'll be discussing the connection between the two and really getting a deeper understanding of this connection. And hopefully we'll be able to encourage more people to have an open conversation regarding this topic. This is because often, of course, mental health conditions and sexual disorders, they are not talked about quite often because of course, people desire treatment and a resolution of their condition, but unfortunately, most are reluctant and unlikely to request this treatment out of maybe embarrassment or shame. So those who do end up seeking treatment, often it's quite late on in the stages. So many have waited for many years to do so. So the aim is to really empower men to feel more confident to address these issues at an earlier stage. So before we begin, I would just like to do some housekeeping rules. You can use the chat function for any discussions that you have amongst each other or that you would like to, any points that you would like to bring in. And then we will also have the Q&A at the end of this webinar, which we will get to. So this webinar will be around 35 to 40 minutes between Sam Shaw and I. And then we will get to the Q&A where you can just also raise your hand and I will unmute you and you can contribute to whatever you would like. So in total, this webinar will be around 1 hour long. So yeah, as said before, I have Sam Shaw here with me today. Would you like to introduce yourself and let us know a bit about your background and tell us a little bit more about Numan?
Absolutely. Well, it's great to be having the discussion, first of all, because I think there is so much about healthcare where we end up treating the symptoms without really getting into the underlying cause. And if we think about longer term well-being and reducing poor outcomes and trying to really improve health, we need to start having a discussion that's wider than maybe just the physical manifestation of illness, but starting to get into that depth. So by way of background, I am the Chief Medical Strategy Officer for Numan, and I'm a public health clinician by background. I have worked in primary care and hospital services, but I was also previously the Director for Digital Development for NHS England, NHS Improvement, and NHSX. And during the last few years, I've worked on lots of things around digitization of healthcare across the ecosystem in England, as well as supporting organizations globally in other parts of the world. And what's really fascinating is that our problems are very rarely unique. The problems that we have in places like England are the same sort of problems that are faced in other parts of the world, just to a greater or lesser extent. So there's a lot that we can do by learning from one another in different places, but also about different modes of trying to provide access to healthcare, especially those areas that are more difficult for people to deal with, more difficult topics. Now, I'm not a GP by background, and I am an epidemiologist, but very much interested in how we can improve accessibility and awareness of the underlying causes of poor health for men in order to try and improve outcomes and improve access to services.
Right. Yeah, that is very interesting. And that's also like a key part is making sure that people are aware of these underlying conditions and people are aware and educated in these different topics so that they can feel that they can access the support and talk about it in the first place as well. So yeah, the
Completely.
topics that, oh, sorry, go ahead.
Absolutely. And I think that, a theme from when you opened till now has very much been about the discussion that people have, being able to talk about things and start talking about things in an open way and seek the right help and support.
Yeah. So yeah, the topics that we'll be covering today will be a holistic view of health and well-being. We'll be talking about common sexual disorders among men, as well as touching on different types of therapeutic interventions that there are. And then we will also talk about biological factors that affect men's sexual functioning, as well as psychosocial factors that can affect men's sexual functioning. So, to begin with, the whole person approach and the holistic view of health and well being. We often tend to overlook these fundamental connections between our mind and our body, as our psychological and emotional state can significantly also impact our physical well being, or the other way around. So, through understanding this connection, we are able to provide individuals with more informed interventions, which can be adjusted to their personal needs and taking into account not just their biological state, but also psychological and social needs as well. So, encouraging this more holistic, whole person perspective. So, for example, we are all unique in the way we experience stress. We could be emotionally affected, such as feeling depressed or irritated. We could be showing behavioral signs, such as eating too much or too little, or smoking or drinking more than usual. We could also be affected physically, such as low energy or headaches, and many more. I mean, it could just be one of these, or it could be all of these together. So, keeping that in mind, there's so many individual differences to experiencing different conditions. And this can really help with the early detection and prevention of also mental health conditions, but also sexual disorders among men. So, this brings me on to my first few questions for Sam. So, prevention is also one of the key factors that you focus on and really advocate for. Why is it important to take a biopsychosocial or holistic approach when understanding sexual well-being?
Well, sexual well-being, like anything else, results from underlying a number of factors, whether they happen to be genetic, whether they happen to be relating to what people might eat, but more importantly, often relates to what might be happening in someone's life at a particular point in time, including their lifestyle. And if we think about prevention, there are different types of prevention, but ultimately, what we're trying to do is prevent people from becoming unwell, and we're trying to improve their experience, their sense of well-being, but also the satisfaction that they have in their lives. Now, to do this, we need to really get into the core of what are the things that relate to people becoming unwell, whether that is in relation to their mental health and stress and anxiety, whether it's their physical health. And within that, I also mean their sexual health. And if we look at the underlying causes of some of the sexual disorders that we'll discuss today, and some of the types of condition that arise in the whole sort of sphere of sexual health, many of those are caused by underlying causes that can be prevented. These are all largely preventable illnesses that we're discussing. So it's really important that we don't just focus on treatment, but we also focus on how we can help people, thinking not only about the biological way of preventing unwellness, but more importantly, also thinking about the aspects of mental health. And we can certainly see that people's lifestyle changes as they experience different things. So when people are very, perhaps very depressed or very anxious, they might change their diet, for example. It might affect their ability to exercise. It might affect their ability to even do basic things like going for a walk. Now, the knock-on impact of those things are, of course, that it might result in some manifestation of physical illness, whether that is something like back pain, or whether it might even be going as far as something like erectile dysfunction. But all of these things have some underlying cause that could be prevented, which is why it's really important that we raise awareness, but we also help people understand the sorts of things they can do to prevent that sort of thing happening in the future where possible. And there won't be one model that fits everyone, but there'll be a combination of things, and it's important to recognize that combination.
Yeah, absolutely. So, would you say that when looking at men's sexual well-being, the focus has primarily been on biological factors rather than psychological or social?
Do you know, I think most definitely until now, there's been a real push towards focusing on physical manifestations of illness and trying to deal with those things. So whether it's erectile dysfunction, or whether it happens to be something else, it's very much been trying to treat that specific problem. But when we take that holistic view, we go much further beyond that and try and understand some of the underlying causes, whether they happen to be relating to mental health or whether it's environment and all of those things. And that's why it's so important to take that much broader view of individuals. And we're now beginning to see that. We're going to see a shift now where it's become more acceptable for men to be able to discuss feelings and emotion to discuss things like stress and anxiety and pressure. And some of these things weren't so acceptable, let's say 10 or 15 years ago. But I think there's been quite a bit of movement in society to actually make it more acceptable. And now some of that's happened because of perhaps in some ways the influence of, let's say, celebrity. Some of that's happened because general movement in society recognizing the impact of poor mental health. But there's certainly now a movement towards understanding mental health and well-being alongside physical health and well-being. So we don't just focus on the biological model, but we focus on the entirety of an individual with all of those different factors.
Yeah, absolutely. And it's so important that this shift is actually happening because, like you said, this encouragement of talking about feelings openly and feeling empowered to do this, that is something that can really help with creating interventions as well and helping people to live a fulfilled lifestyle where they feel like all of their needs are taken into consideration. So, if someone experiences symptoms of a sexual disorder, when would you encourage them to seek help?
Well, I think it's really seeking help and advice as soon as they really start noticing those symptoms. Now, that doesn't necessarily mean they have to see somebody to begin with. It might be having a discussion with someone, they could have an online interaction with the clinician, or it might be that they're simply looking up advice and information and trying to implement some of those things to begin with. But certainly start exploring the different reasons that it might exist. Now, for most people, it might be short lived. It might be because of stress in their life. It might be because of anxiety they're experiencing at a particular point. They might be suffering from certain symptoms. For others, though, there might be a bigger underlying reason. It could be relating to, for example, diabetes. It might be relating to the way in which they are responding. It could be due to other medication that an individual's taking. So the most important thing is to find out a little bit more early on as possible, because quite often by simply doing some basic things, by being under review, by having blood tests undertaken, it's possible to identify whether someone has actually got some underlying vitamin deficiencies. It might be that they actually are suffering from something else, such as diabetes, or there might be something else going on. But it's really important to take that advice early on. And in most cases, it's often easily dealt with. It's often easily dealt with by a combination of dealing with stress and anxiety and sorting out the symptoms at that moment in time. But for others, it might require a bit more help and support. And that's why it's really important to just make sure that you're aware of those symptoms, that you talk about them early on, and that you start seeking help and advice as soon as you feel comfortable and able to do so, but don't leave it too long.
Yeah, absolutely. So this then brings us on to some common sexual disorders among men that we would like to discuss. So of course, sexual disorders, they have a significant impact on the quality of one's life, and really getting a better understanding of what they are and what to look out for can really help with understanding and seeking help at an early stage, as you had mentioned before. So the most common sexual disorders among men have been found to be erectile dysfunction, premature ejaculation, and hyperactive sexual desire disorder. Erectile dysfunction has a significant prevalence within about 18 to 30 million men being affected by it. And complete erectile dysfunction has been defined as the total inability to obtain or maintain an erection during sexual stimulation or the absence of nocturnal erections. So this then leads me on to some questions I would like to ask you about erectile dysfunction. Are there different degrees to the severity that one can experience erectile dysfunction?
Yeah, I mean, it's definitely going to vary. There'll be complete variance between, to the extent to which it affects different people. And for some people, it'll be much more sort of severe, and for other people, it'll be less severe. And it might even vary across the life course. And for some people, it'll be very temporary, and for others, it won't. And so that's why it's important to get to really seek that help early on to work out what it is. One thing I would also say is that the most of the data we have is based on people accessing services, based on expressed need, is how we know about what's happened. But actually, it's probably an underestimate. It's an underestimate because the type of topic area is often it's stigmatized. There's embarrassment attached to it. There'll be a lot of people that don't present to services, so the chances are the proportion of the population who might be affected is probably an underestimate based on where it actually is. So it probably is a lot higher. Now, that will, of course, vary, as we were just mentioning there, between those people that might suffer perhaps very low levels of erectile dysfunction. It might be, fairly intermittent, and it may not be a continuous thing, to those that might have almost, total erectile dysfunction. And so, there is a difference there. So it is important to work out which of these it is. And then, of course, treatment will vary depending on which it is, because some people, depending on what the underlying reason is, it might actually change the way in which the erectile dysfunction is treated.
Right. Yeah, absolutely. Yes. I mean, of course, all of the data that we have, they're based on self-report measures. So basically, there can be so many other people that we really don't know about. And as we said, this is really a topic that is not discussed frequently and that people quite shy away from quite frequently. So there's, of course, an underestimation probably of data of this. Do you believe that erectile dysfunction affects mostly older people, or is it similar across populations?
Do you know, it probably isn't uniform, and just with most things. So it's probably, there's probably some sort of normal distribution of how it is distributed in the population, but I wouldn't say it is uniform across the population. And the likelihood is, based on based on the information we have and the way in which it presents itself, it probably affects older people more so than it will younger people. But certainly, I'm seeing a mixture of reasons people are presenting. And anecdotally, I would certainly say there are more younger people currently presenting. And much of that we sort of think is due to performance anxiety related, more so than it being due to an underlying medical condition. But it's quite clear that it certainly affects older men more so than younger men. So those people, over the age of 35, 40 seem to be more affected than those people below that age category. That's not to say that it is in any way sort of uniform across those groups. And you do tend to find that there are, much older people who are more likely to suffer it. Now, there are so many reasons, and it really depends on what some of the underlying causes are that make sense. And if we look at what actually happens in terms of the deposition of fatty substances around the blood vessels, we look at circulation, we look at the impact of things like diabetes, you can really get a sense of why those age groups might be more affected. But certainly it is something that older men, or middle-aged to older men, will suffer more from than younger men.
Right. Yeah. And we will touch upon all of those biological factors a little bit later on again as well. Um, you mentioned something about performance anxiety in younger men, and that there has been a little bit of a shift as well that younger men experiences as well. Can you elaborate a little bit more on this performance anxiety or modern stressors that might affect this?
Yeah, I mean, look, we're in a society now where there are expectations on people out there, and more younger people that are sort of affected by what's expected of them from their partner, from society. And you can certainly see that if we look out there, the sort of expectations on young men are certainly far greater now, I think, than they perhaps were in the past, or at least more known about. And that then itself comes with a series of impacts. And because of that sort of the anxiety people suffer and that stress that people are under, and there's so many reasons for it. It could be because of the media, it could be because of the role of celebrity and influencer, but often it's related to how they might perceive themselves and how they might actually relate to their partner, and probably not even necessarily having the sort of discussion that's needed prior to actually having sex. And because of that, that can result in some sort of anxiety and stress about being able to have sex. And as a result of that, this term of performance anxiety sort of comes about. And it's more than it just being about the physical sort of act, right? Because it's all about emotions. And when the mind gets far too stressed, that's when this manifests. And so, because the mind gets stressed, it's not possible for the body to then respond to that. And so you end up with an absence of sexual arousal because of that. And there are so many different reasons, as we mentioned, that the people need. It's fear of not being able to perform. There's things like, poor body image, for example, can also be an issue for some people. Concerns about weight, problems and underlying problems in the relationship itself, if there isn't that depth there. And then also, things about where people are actually worried about how they're perceived and about sort of, size and that sort of thing. And that can also be a problem. So all these anxieties together can result in a lack of enjoyment, but also the difficulty in being able to perform. And so it's really very much not about, in this situation, just providing medical treatment, but in this situation, actually providing ways of being able to allow people to sort of free their minds, but also to try and de-stress them. And that's the important thing. And that's easier said than done. But that is, and it's important to try and address that. And that requires people to talk about what they're thinking about, why they might be facing this. And if we really get into the things around image, being comfortable with one's image, and that's where that whole piece sort of comes in, around where the role of celebrity and influencer is in this. But this can be cyclical, and that sort of performance anxiety can be quite cyclical. People get very anxious about it, and it often means that they can't really deal with it. And really, to get over it, there isn't any sort of one thing, but talking to a therapist is one option. Taking some medication, of course, is a short-term option, but probably not sustainable. But actually, the most important thing is for an individual to be open with their partner and talk it through. Seems to be the biggest thing. But other things people do is work out techniques of distracting themselves, which also help break the cycle of the anxiety.
Yeah, absolutely. And this is where, of course, psychotherapy and the mental health component plays a really big part in this, of course. Um,
Completely. And that ability for adults to have, talking therapy is so important, especially when they're faced with, conditions such as this that have got such a large psychosocial component to them.
yeah, definitely. Yeah, so the other two topics that I wanted to cover was premature ejaculation and hyperactive sexual desire disorder. Premature ejaculation is likely to be the most common sexual dysfunction in men, with a worldwide prevalence, but as again said, it's self-reported, of 30% across all age groups. And the most accepted definition of premature ejaculation is that it is a condition of short ejaculatory latency that causes personal distress and is beyond the patient's ability to control. So some studies have shown that median ejaculation latency time has been recorded as 7.3 minutes in men without premature ejaculation, and those with premature ejaculation had a median time of 1.8 minutes. So this is just a bit of background on the condition itself. So because premature ejaculation has shown to be similar across all age group, it has been considered to be primarily a psychological disorder. So do you think that this is still the same, or do you think that people have started looking at also the biological factors of premature ejaculation nowadays?
I think it's still the same, actually, because I think, there's a recognition that stress, depression are still the underlying risk factors for premature ejaculation. Being some of the bigger reasons behind it. And it probably again is underreported. It's probably likely that this again is underreported. So it's and there are differences here, right? We've got to differentiate between those people for which it happens to occasionally versus those people that have had this all the time and where it's lasted almost all of their life, or at least more than 6 months. And certainly in countries like the UK, there's quite good clinical guidelines on how to go about identifying premature ejaculation, how to go about treating it. But it is complex, and the treatment for the recognition is that it is it does relate to a psychosocial disorder, which is why we've got to think very carefully about when and how do we go about treating it. But there is, of course, there's a chemical component to it, but that chemical itself is determined by, of course, someone's emotional state and stress. And some of the factors that can play here, everything from sort of stress, depression, as I mentioned, but also anxiety, relationship issues, and again the same things we had before. But some of the other sort of causes can be very unusual hormone levels, for example, can be other reasons that it comes about, or irregular levels of certain sort of neurotransmitters, for example. So an imbalance of chemicals in the brain can also relate to this. And even things like inflammation, and that's a different reason, but inflammation around the prostate or the urethra can also be a reason that this might happen. And there is some recognition that there could be a genetic component to it. Some people, they might genetically inherit the likelihood. But and there are a smaller group, but actually we don't know what the size of the group is, where there could be a combination of premature ejaculation itself being related to erectile dysfunction, and that is another sort of group that we have to deal with. But to diagnose it, it's very hard, and often it's based on understanding what's happened with an individual and what they've experienced over what time period, how often it's been going on, and then that sort of takes us on to treatment. Now, for most people, behavioral techniques tend to deal with premature ejaculation. And you tend to find that most of the time, clinically, everyone's reluctant to intervene. And there's a really good reason for it, because the medication that we're going to be using, or we do tend to use, does, of course, affect mood and does affect, depression. So medical intervention for this is almost the last thing you want to be able to do. The first thing you really want to do is be able to identify what the underlying causes are, where it's originated from, the type of premature ejaculation, and try and give people techniques to cope, manage, and deal with the symptoms, and really get into some of the underlying psychosocial reasons behind it, and try and differentiate it from what could be some of the other reasons it may exist. But treatment very much in this situation is probably the last thing we want to almost get into, because it's possible to treat somebody, but certainly the medication we'd be using in this case can itself affect mood. So it's important to try and do other things, like getting people to talk about things and use other techniques, and part of that is also distraction.
Right. Yeah, absolutely. My other question would be if premature ejaculation and erectile dysfunction, if they can be comorbid with one another, and if so, if they coexist with one another, is there going to be challenges with treatment if that is the case?
Yeah, I mean, I think there certainly are good examples, and certainly from our clinical practice, we know that there are certain examples where both present themselves. And what we also find is sometimes when we treat erectile dysfunction, the premature ejaculation as an issue becomes less apparent or less problematic. So we do know that both present often, and there are common reasons that they can both present at the same time. And obviously some of those you've already sort of touched on. So by treating one, we can sometimes alleviate the symptoms of the other. And typically we treat erectile dysfunction, and sometimes the premature ejaculation becomes less of a problem, or can be treated in a different way. But there are issues with trying to treat both of them. And the main issues are, as well, of course, we're medicating people, so we want to be careful about that. But the second thing there, of course, is the type of medication we're using for premature ejaculation itself is something that is going to, effectively, it's an antidepressant that we're using. So, you end up then trading one problem for another quite often. And that's why it's we're very reluctant to treat premature ejaculation until we really have to. And typically we'll try and treat it with other things. We'll try and treat it with sprays that help, reduce sensitization and cause delay and those sorts of things before we get to the point where we actually medically treat somebody. But the biggest problem of treating both at the same time is really trying to work out which of the two is it that's the underlying cause or the problem here. And then treating one first before the other is often what you try and do. But it is hard, and the biggest problem here is for the individuals expecting this is that, of course, they are, it's very stressful. It can affect their relationship, and that can obviously have a knock-on effect about their perception of self, which is why we've got to really work hard to help balance the emotional factors with the medical symptoms.
Yeah, absolutely. And this then leads on straight to some biological factors that you already touched upon, as well as the psychosocial factors, which we will cover a little bit later on. So these are some biological factors that Sam has already mentioned before that can affect the the risk of having symptoms of a sexual disorder, or make it more likely to develop one. So we'll be beginning by talking about biological, then move to psychosocial. And of course, as most of you are probably aware, drugs and alcohol can affect sexual functioning. And research has found that at least one type of sexual dysfunction was present in 72% of subjects who were diagnosed with alcoholism. And there's also risk of erectile dysfunction increasing significantly in those who smoke more than 10 cigarettes per day, or who have been smoking for 10 years or more. Would you say that drugs, alcohol, and smoking are a significant cause to also why younger people experience sexual dysfunction?
Yeah, I mean, I think, we can probably, I could talk about this at length across healthcare, really, because ultimately, anything that has got there's got some sort of effect, a toxic effect, and of course, drugs, alcohol, smoking, other medication. Of course, at the end of the day, these are substances that we are giving to our bodies that are not necessarily natural, and they have a whole range of impacts. And so it's undoubtedly, the case that if someone is taking drugs, if they are drinking, consuming a lot of alcohol, and if they're smoking, there's a high chance that they are going to suffer other illnesses, of which erectile dysfunction will be one of many. But take something like smoking. We are all quite familiar with the fact that smoking, of course, affects people in many different ways, and and unfortunately, it can also affect sexual health as well. So, and it's also no different for alcohol. It is a drug at the end of the day, and if you think about the knock-on effect of it, this, of course, affects the extent to which blood vessels are going to be able to properly operate in the body. And if you think about the way in which blood vessels can end up sort of recessing, these are affected by drugs, alcohol, and smoking. And it's the very same reason that people suffer from other diseases as a result of all three of these substances. Now, clearly, there's a balance to be had, and there's moderation that people need to operate within. But it's really the excess of these three that can result in poor sexual health as well. And that's why it's important to give people advice on wider well-being. How do we help people identify and understand their biomarkers so that they can try and keep fit and well, so that they're less likely to suffer from diseases such as erectile dysfunction, for example?
Right. So if a smoker stops smoking, or someone stops drinking for a significant amount of time, would their sexual functioning return back to normal?
Yeah, it could do, and in most cases, it probably will do. That's not always the case, but in most cases, it will do. And in most cases, by stopping smoking and stopping consumption of alcohol, or at least reducing it, people do tend to find they get some normalization. But it really depends on what's actually happened. Like, was it purely because of the impact of the drug on neurotransmission? Or was it the impact of taking these substances that's actually changed you biologically, and that have you ended up in a situation where there's lots of plaque deposition? Because if the alcohol has resulted in, let's say, for example, obesity, then that would have in itself have an impact in obviously the deposition of fatty substances in the vessels, which means it's more difficult to have maintain normal sexual function. So it really depends on what, but for most people, it will tend to normalize after they cease doing these things. With smoking, you can't necessarily reverse all the damage. So the damage that's done from nicotine in particular, from cigarette smoke, and the impact it has is much harder. Of course, it will in some cases reverse to an extent, but it is much harder. And there's obviously the impact of drugs. It depends on which drugs. It's a broad category there. Drugs is an umbrella term, so it depends on which drug somebody may have taken. But by and large, at least the symptoms won't be ongoing in most cases. And sometimes there are things that can be done to help reduce the presence of those symptoms.
Right, absolutely. Yeah, so another important factor that I would like to explore with you as well is sleep. Of course, sleep
Yeah.
is considered one of the third pillars of health, along with diet and exercise. And of course, lack of sleep can and sleep quality can have a significant impact on our physical and both our mental health as well. And it also impacts our hormone levels. So the big issue with sleep, of course, is also that often it's widespread but commonly underdiagnosed. So many people don't even know that they're experiencing a sleep disorder, such as sleep apnea, which can be easily detected through when somebody is snoring or has low blood oxygen levels. There's also restless leg syndrome or nocturia, which is when somebody has to get up to urinate often during when going to bed. So these are all things that really disrupt the quality of our sleep. How common would you say it is for men to have sleep disorders along with sexual disorders?
It's probably more common than we know, and people don't talk about it. So we probably don't really know to the extent to which it exists. But I suspect, based on people that we've seen, it probably is more common than we actually realize. And certainly, if you look at the interplay between hormone balance and then erectile dysfunction, for example, you can see a pattern there. And and it's double-edged because, of course, balancing hormones is needed for good sleep, and good sleep is needed to produce the right sort of hormones. For example, testosterone, most of it is released during people's sleep. So I think it's one area where we underestimate the impact, and there's a couple of things that can be done. The first is recognizing the role of hormones that impact on people's sleep, and really, recognizing the fact that there's such a complex combination of hormones in what we call, clinically call the endocrine system, and we've got to deal with that first of all, and deal with the fact that we've really got to help in making sure we maintain certain hormone levels to help improve sleep. And the main hormones involved in sleep for everyone. And of course, for example, if you take women, it's estrogen, and you've got other hormones such as progesterone as well. And then if you look at men, of course, you've got the dominance of testosterone and insulin, and then of course you've got cortisol. And then you've got melatonin, which of course is another hormone that is commonly known about, and most people know that people often use that in order to help gain sleep. But controlling hormones is an important part of gaining sleep. And people might be familiar with ways and techniques of doing this, because obviously we want to turn to drugs last, but start off we're trying to promote better health. And some of the things that people can do is reducing the amount of screen time, for example, before they go to sleep. This is important. So watching TV or using a phone can suppress melatonin levels. So that can then result, of course, in significantly affecting sleep and making it difficult for people to fall asleep. Finding ways to de-stress before going to sleep. And it might seem so obvious to people, but it's something we would certainly recommend to help people get better sleep. And that could be done through all sorts of different things, whether it's meditation, candles. For some people, some light exercise can even help. For other people, light exercise can wake them up. So you've got to be a bit careful. But it's about having a routine and trying to do that. And alongside having that routine, you also got to balance it with what you eat. And the reason for the whole what you eat piece is because, of course, you've got to think about how you affect hormone levels. So eating before bed generally isn't a good idea, because of course you can raise your insulin level and your cortisol level. And of course those things are not great in terms of helping you sleep. So to get good deep sleep, where you've got rapid eye movement in sleep, you really got to focus on that quality and doing those things beforehand to try and de-stress and improve the quality of the sleep you'll get. But understanding your hormones, your own rhythms, is an important part of that. Now, if we look at testosterone more specifically, testosterone has a large part to play, of course, in erectile dysfunction, as we've probably sort of already touched on. It's probably already quite obvious to most people who are perhaps watching and listening today. But of course, testosterone itself is generally released when people sleep. So if you're not getting good quality sleep, the chances are you're probably not releasing sufficient testosterone, and it of course is going to affect the way in which diseases such as erectile dysfunction manifest. And it's an underlying signal that it's probably going to happen. So it's really important to get good quality sleep and think about regulating hormones so that people can make sure that they produce enough testosterone that then helps avoid some of the other issues that they might face.
Yeah, absolutely. And as you mentioned before, it's so important to have this routine. We're creatures of habit. So it's really helpful for us to have this chronological rhythm within the 24 hours, to have a certain time where we go to sleep and where we wake up. This really helps our body to regulate itself,
Yeah.
with all the hormones and everything. Of course, there are challenges with this for frequent travelers or people who work shift hours and all of that. So would you say that they are more at risk of having sexual disorders?
In Well, I don't know actually. I have no idea if they're more likely to suffer it or not. But logically, you'd think that it probably does affect them, but it probably affects them for a different range of reasons. It's probably lifestyle, stress, tiredness, all of those things together in combination are probably an impact. And I'd certainly say for those people who are frequent travelers, they soon get accustomed to finding clever ways to help them get better sleep, all from the timings of the flights they happen to take and trying to take, night flights and trying to avoid eating on planes or when they're traveling, those sorts of things. And obviously, at the moment, very few people are doing
Yeah.
very much international travel. But I think you're probably right in that those people who do have slightly more um, chaotic cycles or less regular cycles perhaps are more likely to suffer from lack of sleep, lack of good quality sleep, and probably likely to produce less testosterone as well. And undoubtedly will also, to some extent, be affected in terms of erectile dysfunction as well.
Yeah. So yeah, we also covered a little bit on aging before, as Sam has mentioned when we were talking about premature ejaculation and erectile dysfunction, as well as chronic disease such as diabetes and cardiovascular disease, which are underlying conditions. So this can bring
And
us on to, yeah,
And
go ahead.
Alyssa, it's probably worth me just saying actually is that, whilst testosterone can impact itself on erectile dysfunction, we just mentioned that earlier. One of the challenges is that replacing it doesn't necessarily solve the problem because it, of course, there's the underlying issues. So for anyone listening and thinking that taking some testosterone replacement will solve the problem on its own, it probably won't. But it's often about that holistic view, dealing with sleep, emotion, mental state, stress, as well as testosterone, and then separate that alongside it, dealing with erectile dysfunction.
Yeah, absolutely. So yeah, talking about the holistic view, let's consider some psychosocial factors that affect men's sexual functioning as well. As you mentioned before, there is this anxiety, this performance anxiety that men can sometimes experience, and I can see that there is a question from the audience within the Q&A about this disappointment. So how do you overcome the feeling of disappointment when you can't perform, even though your partner says all is fine?
I think this is a really complex topic area because the reasons for that disappointment will be deeply entrenched in so many things in people's, it will be around the way in which they respond to a whole series of things beyond the situation that's facing them then, about their emotions, about the way in which they deal with disappointment in life in general, and who and how they can talk to people. So a recommendation in these situations is, of course, talk to their partner, but also, if it's something that's happening on an ongoing basis, seek some support. And often that might be from a psychotherapist or from someone else. But it's probably about speaking to someone independently as well about, how they feel. Because, uh, of course, there'll be the other person involved in that. But at the same time as there being the other person having that openness, it's important to try and work out what some of the underlying reasons are around that. But that sense of disappointment is, can be very worrying, and in itself can continue to generate stress. So I don't think there's a single and a simple solution to advising people that are facing that. But the most important things is having open discussions about it, and then seeking some advice and support, and also being proactive where possible, and trying to work out ways of trying to overcome the issue to then help try and reduce that sense of disappointment and that anxiety that comes with it. But this is easier said than done, and by no means simple. So it's important for people to really seek help and advice. Now, some of that could be online. There are some really good apps available now to connect to psychotherapists and those people providing talking therapy. There's also ways, of course, of doing that in person. And it's obviously possible to go and see a healthcare professional as well. But whatever of those it is, it's probably important to recognize it, acknowledge it, and getting that sense of disappointment, doing something about it early so it doesn't then result itself in stress and anxiety later on.
Right, absolutely. And we'll touch upon that a little bit later when we talk about therapeutic interventions and different options that you can take in order to be able to address any sort of issues that you have and to increase communication. Would you say that lack of communication is a perpetuating factor maybe with common sexual disorders, like a
I
maintaining?
mean, I think it is, right, because the problem is it can be very embarrassing. It can be quite stressful when it's happening, and people don't like to talk about these things, not with their clinician, and less so, and sometimes it can also be they don't want to talk about to their partners about it because of the embarrassment and the anxiety that goes alongside it. So I think this is a big problem, and part of that is because in society this has become what might be a taboo topic area. So what we've got to find out and work out what we do is how do we make this a less embarrassing area to talk about, that people feel more comfortable having a discussion, and there can be some more openness. And sometimes it might involve talking to somebody else about it first before discussing it with a partner or someone else. But it's important to have that discussion and have that openness, because that will be part of the path of trying to resolve it if it's possible, or seek treatment.
Yeah, absolutely. There's another interesting question from the audience, which links to the last point about emotional states, stress and depression, anxiety, all of that. So the question is a high stress environment in the workplace also likely to lead to erectile dysfunction in private life?
I think there's every possibility that could happen. Now, obviously, there are individual circumstances there for individuals who are sort of worried about what's happening in their workplace. Now, some of them might have other factors as well, but undoubtedly, if someone's very stressed and very anxious, then it could well affect their likelihood of getting erectile dysfunction, and that is entirely possible. And alongside it, you tend to find other things go alongside that. That stress in the workplace can result in lack of sleep and poor sleep, which itself produces, of course, the individuals might have very high cortisol levels. They might be producing not enough testosterone. In addition to that, there might be erratic diet and eating, maybe lack of exercise, poor circulation. All of these things can happen. So certainly for people in very stressful jobs, very stressful work environments, there is a risk that they might be suffering from erectile dysfunction because of that situation.
Yeah, absolutely. And as we mentioned before, having certain mood disorders, or it has also been found that people who have depression are very likely to also suffer from erectile dysfunction or premature ejaculation, as well, as those have also a clear biological link with our hormonal levels, as well as our life satisfaction overall as well. So this increased stress within our body releases certain um, neurotransmitters and certain hormones that can lead our body to react in a certain way where it will not function the way that it should. So, taking into account this mind and body connection, would you say that this multidisciplinary approach would be most appropriate when addressing sexual disorders?
I mean, I think the multidisciplinary approach is important for so many health conditions, including, sexual disorders as well. I think, we've got to really recognize the fact that taking an approach where we think about the mind, the body, and then well-being more generally, I think we've got to try and change the way in which society thinks about health. That healthcare that we currently see, which is taking some medication, seeing a doctor, going to a hospital, is only one dimension to it. But we have to take a much broader view, which is going to be about everything. It's going to be everything from the one side, which is diet, sleep, lifestyle, exercise. On the other side, it will be about people's mental well-being, and that is seeking the right sort of counseling and other sorts of support, which could be delivered in a whole range of ways, and then combining that where it's right to do so with the medical model as well. But we do need to take a much more holistic view and have a much more multidisciplinary approach doing, providing most of healthcare. And certainly in the space of sexual health, and if we look at things like erectile dysfunction, premature ejaculation, these are two areas where certainly there's a big component that relates to the to mental health, to stress, to anxiety and depression.
Yeah, absolutely. There's another interesting question from the audience. It's about mood disorders, and can depression, stress, and anxiety cause the opposite of premature ejaculation, where you can't achieve orgasm?
Yeah, I mean, if we take ourselves into, and obviously I'm not a psychiatrist by any means, and but from a public health point of view, we recognise the fact that people will suffer all sorts of things as a result of mental health. That stress itself may just avoid, mean that it's just very difficult for them to engage, and there's so many subcomponents to that because, of course, they might be struggling with maintaining their relationship. It might be having an impact on their relationship, how they feel, their mood. So there are so many things that go into having fulfilling sexual relations that could be impacted by depression. And think about it another way. People who are often depressed, they can often have, in some cases, when that depression gets quite severe, can often have short attention spans, difficult to focus, hard to focus on their relationships, thinking about other things, worried about the depression itself. And of course, the impact it's having on that relationship means it's just very difficult. So yes, absolutely it can, and that's why it's important for people to seek advice and support, not only to deal with the symptoms, which might be erectile dysfunction, it might be inability to actually have fulfilling sexual relations, but also to deal with the underlying issues, which themselves could be depression and anxiety.
Yeah, absolutely. So I'm just conscious of the time. I did want to cover a little bit on socioeconomic status and health equity. And that is, if you want to say just something short about it, and we can cover more maybe next time.
Absolutely. So one of the things that people often don't recognize is the wider social determinants, and that is all the other things going around us, affect our ability to access healthcare and make use of healthcare. They also affect our ability to gain outcomes from health services and outcomes for ourselves. So our outcomes in life will be affected by everything else around us. And more broadly than that, the inequalities in everything from the experience of disease through to what might be available to us is affected by everything else around us. And that is, in the mental health and the space of mental health, we know that that is equally true. So those people who might be in deprived settings, in low income jobs, in highly stressful environments are probably more likely to suffer from certain diseases, including mental health conditions, than other people. And we've got to recognize that the ability for everyone to access services is so important. Now, historically, those were physical services. So when we think about fixing this in the future, we need to think about it in the space of virtual services as well, and how we can make other services, such as mental health services, more accessible to groups from those communities. But dealing with the wider social determinants is a very important part of dealing with some of the problems that we've talked about today.
Yeah, absolutely. So it's about making the service accessible to everyone so everyone can have the exact same high quality interventions and understanding of what they can do in order to have a better lifestyle and increase their health and look after themselves in a better way, let's say.
Yeah.
So this brings us on to therapeutic interventions. There's another good question from the audience. You always mention that medication is the last resort. How does that fit to the Numan offering of mainly selling prescription drugs online?
Yeah, so I probably should make it clear. Numan doesn't just sell prescription medication, but I think what's important is that we offer access to treatment through an online consultation, first of all. And the model that we use in Numan is really important because we, first of all, assess individuals and assess their various risk factors, and then decide and determine whether it's right for them to engage in treatment. But alongside that, what we're trying to do is provide awareness, information, education to try and help individuals to deal with what might be underlying issues. And alongside that, what we're trying to do is help educate people. And it's not just about providing medical treatment, but it's also about helping them understand their biomarkers. So, for example, by supporting people having blood tests, we're able to help them understand what other things can they change in their life, whether it's lifestyle, diet, other things that might help reduce the impact of the symptoms that they're suffering. So I can totally understand in a world today when so many things are very accessible, whether it's Numan or anyone else, it can sometimes seem like medication might be the first resort. Medication is part of the story, but actually for us, what's important is providing men and those people affected by men's health with better access to healthcare advice, support, but also that longer term relationship with a health and wellbeing provider that can provide them more than just treatment, but actually start getting to some of the advice and guidance that might help them move on from that too. And part of that for us is also advising people when relevant to seek advice on their mental health, whether it's trying to reduce anxiety, trying to affect depression, which as part of the way we assess patients, try our best to do.
Absolutely. And this is why we've been covering this multidisciplinary approach and the holistic view of health and well-being, as well as mentioning all these different therapeutic ways that one can manage their health better through preventative measures such as lifestyle, diet, exercise, pharmacotherapy, as you all know, and as well as psychotherapy and supplements. What is your stance on supplements as well? Because that would be something that would be of interest.
Well, I think there's, like everything, there's also a place for supplements because these days we probably don't have the same sorts of diets that our ancestors may have had, a couple of hundred years ago. So to try and get that balanced diet can be harder. So some ways of trying to address that is by identifying which supplements might also help us where we might be lacking. So a good way of doing that is by having a blood test, identifying which supplements we might be deficient in, and then getting tailored supplements where relevant as well. But I'd always recommend for individuals to have a balanced diet, a balanced lifestyle, and only to use supplements where they can, add value. But I think supplements are important because for proper biological functioning, for growth, for replacement of cells, everything from hair through to skin, there is a place where supplements can be useful and can be helpful, but in moderation. We've got to make sure that people don't overuse supplements and don't substitute them for a healthy and balanced diet and a healthy and balanced lifestyle.
Yeah, absolutely. And you have mentioned to me before, of course, and we all know that there's a limited evidence base, of course. So only relying on supplements wouldn't be the best idea, as well as only relying on one sort of therapeutic intervention might also not be such a good idea. The most effective way of looking at well-being and looking at the individual is by trying out a mix of different things and seeing what works best for them, of course.
Completely. And I would absolutely agree with that because everyone's an individual. So some things might work better for certain individuals versus other things that may not work so well for other people. So it's really important that, together between both whether it's professionals for an individual that's self-managing their own conditions, their own life, to work out those things and try different things out that work for them. And for some people, supplements will be part of that.
Yeah, thank you very much. So this brings us to the end of the webinar. Thank you very much, everyone, for joining us today. I hope this was insightful to you, and thank you, Sam, for being with us today. It was very helpful to have you here and to have all your insights as well.
Elissa, thank you for having me. It's been a pleasure. And, to everyone out there, thank you for listening. And, do feel free to get in touch if we can be of any help at all. But very much hope that during this time period, during COVID-19, you're all keeping well, stable, and look after your sleep and your mental health.